Have you ever wondered why certain habits, even harmful ones, are so hard to break? Today, we're diving into the intricate world of addiction, how it can start from simple actions and gradually take over, and most importantly, I will share effective strategies for overcoming it, including some cutting-edge experimental therapies being researched. Addiction isn't just about the substance or behavior, it's about how our brain, environment, and personal experiences intertwine to create a challenging cycle. Imagine the brain as a complex machine, with addiction hijacking its control panel. This happens through our brain's reward system, which, while initially offering pleasure or relief, demands more over time to achieve the same effect. Let's talk about what it means to have an addictive personality. This term is often misunderstood. It doesn't mean that some people are destined for addiction. Rather, it highlights certain traits and behaviors that might increase susceptibility to addiction. These include traits like impulsivity, a tendency to seek out novel experiences, and sensitivity to stress. Understanding these traits can be a powerful step in recognizing vulnerabilities, both in ourselves and in others. It is important to remember, having these traits does not seal one's fate. It's the combination of these personal characteristics with environmental factors that can set the stage for addiction. This brings us to the role of our surroundings and experiences. Our upbringing, the influence of our social circle, and our life experiences all intertwine with our genetic predispositions to shape how we interact with potential addictive behaviors or substances. It's also crucial to understand that addiction often starts innocuously. It could begin with social drinking, using prescribed medication, or even habitual behaviors like scrolling through social media. Over time, the brain and body start craving more to achieve the same level of satisfaction or relief. This escalation can be gradual, making it hard to notice until it becomes a significant problem. But how does a habit transform into an addiction? This transition involves a shift from wanting to needing. Initially, the activity or substance is sought for pleasure or relief. However, as one becomes habituated, it's no longer about seeking pleasure, but about avoiding discomfort. That's when dependency sets in. Recognizing the signs of addiction is vital. It's not just about increased tolerance or withdrawal symptoms. It's also about how it affects one's life, neglecting responsibilities, persistent use despite knowing the harm, and changes in behavior and mood. Being aware of these signs in ourselves or others is the first step in addressing the issue. If you notice these signs in someone you care about, approach the situation with empathy and understanding. It's important to offer support without judgment. Creating a safe and open environment for conversation is crucial. Many times, individuals struggling with addiction feel isolated and misunderstood. Showing that you're there to listen and support them can make a significant difference. In our next segment, we'll explore effective strategies for overcoming addiction, including professional help, support systems, and self-care practices. Remember, overcoming addiction is not just about willpower. It involves understanding the underlying issues and addressing them with the right tools and support. Overcoming addiction is a journey in and of itself, often requiring a multifaceted approach. It's not just about stopping the substance or behavior, it's about healing the mind and rebuilding one's life. The first step in this journey is to seek professional help. Addiction specialists, therapists, and support groups can provide the necessary guidance and support. These professionals can offer personalized treatment plans, which may include therapy, medication, and lifestyle changes. therapy, especially, plays a key role in addressing the root causes of addiction, such as trauma, stress, or mental health issues. Support systems are also vital. This includes friends, family, and peer support groups. These networks provide emotional support, understanding, and accountability, which are crucial for long-term recovery. Remember, isolation can fuel addiction, so staying connected with a supportive community is key. Self-care practices also play a significant role in overcoming addiction. This involves nurturing your physical, emotional, and mental health. Simple practices like regular exercise, healthy eating, adequate sleep, and mindfulness exercises can have a profound impact. They help in rebuilding your body's strength and resilience and in managing stress and emotions in a healthy way. Another alternative practice is the use of acupuncture, which is known to help reduce cravings and ease withdrawal symptoms. Mind-body practices like yoga and meditation also offer immense benefits. Yoga combines physical postures, breathing exercises, and meditation to promote physical and mental well-being. It can be particularly effective in managing stress, improving emotional regulation, and enhancing self-awareness, all crucial elements in addiction recovery. Meditation, particularly mindfulness meditation, helps in building a state of awareness and presence, allowing individuals to observe their cravings and thoughts without acting on them impulsively. Another effective tool is the use of certain natural herbs and supplements. For instance, herbs like St. John's wort and kava kava have been known to help with mood regulation and anxiety reduction, which can be particularly helpful in managing emotional triggers for addiction. Additionally, supplements such as omega-3 fatty acids, which are found in fish oil, have been shown to improve brain health and assist in managing depression and anxiety. It's important to note that while these natural remedies can be beneficial, they should be used in conjunction with professional medical advice and treatment plans, especially when in recovery from addiction. In recent years, there's been growing interest in other experimental therapies. The potential therapeutic use of psilocybin, the active compound found in magic mushrooms, which has shown promise in clinical studies for its ability to alleviate conditions such as depression and anxiety, which are often intertwined with addiction. Under controlled clinical settings, psilocybin-assisted therapy has helped many individuals gain profound insights and emotional breakthroughs, contributing to their recovery journey. This treatment, however, is still under research and should only be considered under the guidance of qualified professionals and within legal frameworks. Besides psilocybin, other psychedelics like LSD, MDMA, and ayahuasca are being studied for their potential in treating various addictions. These substances are thought to facilitate profound psychological insights and emotional processing when used in a therapeutic setting. The therapy sessions are conducted in a controlled, safe clinical environment under the supervision of trained therapists. The setting is designed to be comfortable and calming, often resembling a living room rather than a traditional clinical setting, to help patients feel at ease. After taking the psychedelic, the patient experiences its effects, which can last several hours. During this time, the patient will typically lie down and is encouraged to focus inward. The therapists are present throughout, offering support and ensuring safety. Patients may experience a range of effects, including emotional release and deep introspective insights. Following the psychedelic experience, integration sessions are held, which are a critical component of the therapy. The aim is to integrate insights and emotions surfaced during the psychedelic experience into the patient's daily life. Another area of interest is the use of ketamine infusions. Originally used as an anesthetic, ketamine is being researched for its rapid antidepressant effects. Some studies suggest that ketamine may help in treating addiction by disrupting harmful patterns of behavior and thought, and by alleviating depressive symptoms that often co-occur with addiction. Ketamine infusions are usually administered in a clinical setting, under the supervision of medical professionals. On the day of the infusion, patients are typically advised to avoid eating and drinking for a few hours beforehand. The patient will usually rest in a comfortable chair or bed, and vital signs like blood pressure, heart rate, and oxygen levels are monitored throughout the procedure. A healthcare professional places an IV line, usually in the arm, through which ketamine is administered. The dose of ketamine used in this therapy is much lower than what is used for anesthesia. The infusion typically lasts between 40 minutes to an hour. Some patients may experience rapid relief of symptoms, sometimes as quickly as a few hours after the first infusion, though individual responses can vary. Another area of research in treating addiction is in the use of transcranial magnetic stimulation, TMS. TMS is a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain. It's being studied for its potential to reduce cravings and treat addiction, particularly in cases where traditional treatments have been ineffective. Each TMS session typically lasts about 30 to 60 minutes, and patients usually receive TMS 5 days a week for 4 to 6 weeks. During TMS, patients may feel a tapping or knocking sensation on the scalp and hear a clicking sound with each pulse. The procedure is generally painless, and patients can typically return to their normal activities immediately after a TMS session. There's no need for anesthesia, and the treatment doesn't cause side effects like those associated with medication. The effectiveness of TMS can vary. For some, it can bring significant relief from symptoms of depression and reduce cravings in addiction. The full benefit may take several weeks to manifest. TMS is often considered when other treatments like medication or psychotherapy haven't been effective. It's important to note that many of these methods are still in the experimental stages and are not widely available. They should only be considered under the supervision of qualified medical professionals and in accordance with current medical guidelines and regulations. As with any treatment for addiction, individual results can vary, and what works for one person may not be effective for another. In conclusion, while the road to recovery can be challenging, it's also a path to a richer, more fulfilling life. With the right support, tools, and mindset, overcoming addiction is not just possible, it's a gateway to a new beginning. I hope that this video has been helpful. If you enjoyed it, please give it a thumbs up and consider subscribing to see more content like this. That's all for now. I look forward to seeing you in the next video.